Hey everybody, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, I'm going to be discussing congenital heart defects. Let's break it down. Let's discuss some introductory terms. So, congenital simply means existing at birth, and congenital heart defects occur when the heart or its blood vessels do not form properly. So this actually results in atypical cardiac circulation within the body. Congenital heart defects can be classified into two categories, cyanotic and acyanotic. There's some differences between them. So for starters, cyanotic, the blood flows from right to left, whereas it's opposite in acyanotic. So the blood flow is going from left to right. In cyanotic types, the blood is deoxygenated, and then acyanotic, it's the opposite. Once again, it is oxygenated. Now when it comes to cyanosis, it actually makes a lot of sense here. So cyanosis is present in cyanotic. Think about the name here. And additionally, think about what cyanosis actually means, right? So it really goes hand in hand with that blood being deoxygenated. It's the opposite with acyanotic, so there's no cyanosis present. Let's talk about the four types of cyanotic heart disorders. The first one we have is tetralogy of Fallot, and this occurs when there is a hole between the two lower chambers of the heart. The second one is transposition of great arteries, and this actually means the two main arteries are reversed, so they're going to the wrong chambers of the heart that they're supposed to be going to. The next one is tricuspid atresia, and this simply means that the tricuspid valves are not present. And then the last one is hypoplastic left heart syndrome, and this means that the left side of the heart did not develop completely. Now remember, these are all cyanotic disorders, so these will result in cyanosis or deoxygenation. Next, I'm going to talk about acyanotic congenital heart defects. The first one is coarctation of the aorta, and this simply means that the aorta is narrower than what it should be. The next one is the atrial septal defect. So exactly what it says, this is a defect of the atria, the two upper chambers of the heart. With this defect, we're going to actually see some leaking between the two chambers, so we're going to have oxygenated blood flowing into where the deoxygenated blood should be. Same concept with this next condition here, the ventricular septal defect. Once again, this is a defect between the two lower chambers of the heart, the ventricles, and we're going to have oxygenated blood flowing into where the deoxygenated blood is. So keep in mind, right, when I just talked about cyanotic versus acyanotic. So acyanotic is going to be our oxygenated blood, and we can definitely see that with this leaking here. It's going to make the blood more oxygenated. Lastly, we have our patent ductus arteriosus. So, in a previous video, I did talk about the cardiac development in utero. I would highly suggest going to watch that because I did talk about this hole that is present in utero. So the ductus arteriosus. This is a hole that's present when a baby is in utero because they're not using their lungs. When they are born, this hole is going to close. So this is a condition when that hole actually does not close properly. The last thing I would like to discuss are potential causes of congenital heart defects. Ultimately, the cause is unknown, unfortunately. However, we do have a few theories and things that might put your baby at increased risk. So, specific genetics can play a role, the environment, mother's diet, and then the mother's health in general. Additionally, potential links that we suspect are if the mother smokes during pregnancy, if she drinks during pregnancy, if she is obese, or if she has diabetes. I hope you guys learned something in today's video. Come back to my page to learn more.